floating lens, an interesting case of spontaneous ectopic lentis.
Good afternoon everyone. Today I, Dr. Apoorva Goel, is presenting an interesting case of ectopia lentis. There is no financial interest in this PPT. A 58-year-old male presented to the OPD with chief complaints of diminution of vision in left eye since childhood, which was painless and non-progressive. It was not associated with any history of any recurrent redness, any history of trauma or glasses use. Birth and developmental history were normal. Systemically, patient was fit and there were no significant family history. Systemic examination was normal for the patient. On ocular examination, right eye vision BCVA was 6/6. In left eye, he had PL positive, PR accurate in all the quadrants. Tensions were normal. On HBT examination in left eye, it was approximately 30-degree exotropia, but left eye was not taking any fixation and extraocular movements were full and free. Conjunctiva in left eye was mildly congested. On slit lamp examination, cornea had mild edema with DM folds. In anterior chamber, a clear lens could be found within the bag in the anterior chamber and it was touching the endothelium superiorly from 10 to 2 o'clock. On making the patient lie down for fundus examination, it was found that left eye lens has drifted into the vitreous cavity. So on indirect ophthalmoscopy, we saw in left eye the lens was lying on the macula and there was a large macular scar. Cup-disc ratio was 0.3:1 and right eye was normal. Keratometry and axial length are normal. So we did ultrasound B scan for the patient and nucleus was found in the vitreous. It was confirmed that nucleus is in the vitreous cavity as it can be seen in axial and inferior scans, and as well as there are few vitreous opacities in whole of the cavity. So diagnosis was made as right eye refractive error and in left eye it was ectopia lentis, query post-traumatic. A patient was now planned for left eye pars plana vitrectomy with lens extraction. On per-op, this is the per-op photograph for the patient. The lens can be found in the vitreous cavity and there is a large macular scar. Types of ectopia lentis, it can be simple ectopia lentis or ectopia lentis et pupillae. It can be due to trauma or associated with any syndrome. Various complications can be caused due to ectopia lentis such as amblyopia, corneal decompensation, chronic iridocyclitis, pupillary block glaucoma, angle recession glaucoma or retinal detachment. But what was interesting in this case was there was no history of trauma. It was not syndromic. It was a quiet eye and there was a long history of diminution of vision. The lens could have gone back and forth multiple times, but still there was minimal corneal decompensation. Treatment for such cases is initially we'll like to rule out any syndromic association. Then we'll like to correct any refractive error which could be corrected by glasses or contact lenses. We can do laser peripheral iridotomy in cases of pupillary block glaucoma. Surgical management is indicated in case there is lens-induced glaucoma or the lens is in the anterior chamber and touching the endothelium. Visual acuity is not improving with refractive correction. There is retinal detachment or there is lens in the vitreous cavity. So various surgical techniques can be employed such as pars plana vitrectomy with lensectomy, cataract extraction with anterior vitrectomy. We can put IOL like AC-IOL, iris claw IOL, SF-IOL, PC-IOL with CTR or CTS. The take-home message from this case is, in cases of ectopia lentis in the anterior chamber, patient should be advised prone position and early surgery is to be planned to avoid endothelial decompensation as well as any retinal compromise. And a thorough examination should be done in each case to locate the elusive lens. Thank you.
Nice presentation. So the patient was not picked up before 58 years?
No ma'am, he presented first time in the OPD with the complaint of diminution of vision.
Thank you.
Thank you.